Hi, my name is Jack Hildebrand, and today I'm going to be presenting about apolipoprotein E and its effects on TBI patients, both children and adults. For a little bit about me, my name is Jack Hildebrand, and I live and have grown up in Madison, Wisconsin, and I will be attending Edgewood High School as a junior. My main focuses are mostly medicine and science, as I work as a pharmacy technician at the moment. For an introduction about apolipoprotein E, it's found throughout the body, though the function of this protein in the brain will be the discussion of this presentation. ApoE functions in a way that helps lipid transport in the brain by binding to cholesterol, phospholipids, and many other lipids in the lipid category. There are 3 forms of ApoE that transport lipids differently, leading to different outcomes for patients who experience traumatic brain injuries. The 3 forms of ApoE that will be mentioned today are ApoE2, ApoE3, and ApoE4. The first major topic that I'll talk about is apolipoprotein E and its relation to traumatic brain injury as a whole. For traumatic brain injury, it is a rapid injury to the brain that alters the way in which the brain works as a whole. TBI can range from mild to severe and may end up causing disability or cognitive impairment. Traumatic brain injuries impact over 500,000 children in the United States alone annually, and studies have shown that 60% of TBIs lead to disability. In children and adults, traumatic brain injuries become one of the leading causes of disability as more people undergo injuries through motor vehicles or contact sports. For traumatic brain injury and its relation to ApoE, ApoE4 has a much worse clinical outcomes relating to neurodegeneration than the other isoforms, and a decreased lipid metabolism has been shown for the ApoE4 protein, which is the reason for the greater amounts of disability and disease that come from patients who have that isoform. And this is the case because to repair the neuronal pathways in the brain, lipids must be used in this process. Many connections have been formed between TBI and ApoE, and many studies emerging pertaining to the 2 issues. Many of these studies have shown that ApoE2 and ApoE3 have been much more helpful in the recovery process for TBI patients and are preventative for Alzheimer's disease. The image on the top right demonstrates ApoE4's negative side effects, some of which consisting of synaptic dysfunction, mitochondrial dysfunction, neuroinflammation, and tau aggression, while the bottom right image demonstrates how ApoE can bind to lipids and aid in the transportation process. The next major topic that I'll talk about is ApoE in children compared to ApoE in adults. For ApoE in traumatic brain injury in adults, it is often much more studied compared to children, often leading to many more positive clinical outcomes. The ApoE4 protein, as previously stated, has a strong correlation to the development of Alzheimer's disease in adults, and through a lack of lipid transport, the brain cannot heal as effectively and quickly as those with the ApoE2 and ApoE3 gene are able to. This impact on the brain's regenerative function impacts the body's ability to fight neurodegenerative diseases as the neuroplasticity of the brain decays. Adults with the ApoE2 and ApoE3 gene were shown to recover at a much faster pace than those with the ApoE4 gene, demonstrating the lack of lipid transportation as the brain ages and neuroplasticity decays. On the other hand, for children, ApoE is much less studied, and in comparison to adults who have many more studies done on TBI and how ApoE interacts with neuronal pathways, it can be detrimental for children who experience TBIs. When children are exposed to TBI under the effects of the ApoE4 protein, they have been shown to have much worse clinical outcomes with many children developing Alzheimer's disease later on in their lives and many developing disabilities at the time of the incident. Along with neurodegenerative diseases, the decreased lipid production that ApoE4 causes leads to many children who experience TBI. It causes them a path to disability. Children often obtain these traumatic injuries through contact sports or other physical activities where they're prone to falls or injury, which has caused much uprising and new public policies about the way that contact sports are played. And for my last topic for today, I'll talk about prevention and public opinion. And for this topic, as genetic screening has become increasingly popular to rule out TBI, many have suggested using it in sports scenarios to test for the presence of ApoE4. One study asked 846 student athletes if they've heard about ApoE testing, with many answering that they did not know about testing and would not care for testing to be implemented at their school. Along with athletes being hesitant about testing, many of their parents oppose testing as it may rule out sports-related futures for their children. As ApoE and its effects on the body are further researched, it is increasingly more important to be protective against it, especially in contact sports where a majority of children are prone to TBI. Recently, we've seen an increase in protective wear and how it's used in the sports settings, but there are many resolutions that have been proposed, one of which being to influence public policy or more conservatively to stop at-risk children from performing in these sports settings at all. And the top right image that is on the screen demonstrates how different groups of people are affected by TBI, with many, about 25%, being struck by or against in contact sports settings, others being falls. So those can also happen in these sports settings, which makes it just as dangerous. And lastly, I just wanted to thank everybody for listening to my presentation. It's been very fun to research ApoE and its effects on children specifically because it's such like an unknown field. I urge everyone who has the time to read the full paper as it's much more in-depth and not held back by the time constraints. But once again, I appreciate all of you for listening. Thank you.